Hey everybody. Hi. Better Spaces is a health and happiness solution for today's hybrid workplace. My name is Dr. Paul Cachola with PAR5 Physical Therapy here in Randolph, New Jersey, and I've partnered with them to bring you an easy and educational workday session. Today's session is a resilient back workout. A little bit about me. I've been a physical therapist for over 25 years, and I opened my practice 3 years ago. I'm an orthopedic clinical specialist. I got my doctorate from Mercy College in Dobbs Ferry, New York. And my undergrad, I got a BS in exercise physiology from Rutgers University. And I also specialize in orthopedics and golfers. I'm also certified from the Titleist Performance Institute as a certified level 3 golf medical professional. So today, resilient back workout. Let's get into it here. And as always, if you have any questions during the session, feel free to use the chat and we can get that answered. So we can make sure that this session is always worthwhile and informational for you. All right, so let me pull up my slides here. It's a resilient back workout. Now, if you've been to any of my other talks, I always give this disclaimer here that the information that we're going to be talking about and covering today is geared at a general population. So if you are dealing with a specific back issue or injury or trauma or some type of pain, please seek out medical consultation so you get an individualized and thorough physical exam so that you can address your root causes. The stuff that we're going to talk about is, again, very general, based upon, it's aimed at a broad population. So it's not physical therapy, it's just general advice. All right, so the body functions on this alternating pattern of stability and mobility. These segments, as we work through, it has to kind of work from the ankle all the way up to the hand and wrist. So if we look at it this way, the ankle is a stable segment, mobile segment. The foot is supposed to be stable. Work our way up to the knee. The knee is stable. The hip is supposed to be mobile. Today, we're going to be talking about the back that needs to be a stable segment. And areas above that, the segment above that is the T-spine, the thoracic spine. That needs to be mobile. And the region below that is the hip, and that needs to be mobile as well. So let's kind of go into what we're going to be talking about today. We're going to be talking about lumbar stabilization. How do you keep your back strong and stable? And we're going to look at hip mobility and thoracic mobility. If the segments above or below are dysfunctional, if they're tight, they lose mobility, they become a stable segment. And then the lower back tends to become an unstable segment or a mobile segment, which we don't want. It reverses its role, right? So, and then we're going to talk about glute strength and how to develop some glute strength, simple exercises that you can do at home to reduce the stress on your lower back muscles. All right, so let's kind of really quick, I'm going to pull this up. I just threw this in the slide deck. This is the transverse abdominis muscle. Now, the transverse abdominis muscle is the deepest of the abdominal muscles. We have the most superficial, which is the rectus abdominis. That's that six pack that goes straight up and down. And then we have the next two layers, the internal and external obliques, they run diagonally. The transverse abdominis runs all the way around. It starts on your lower back and then wraps around to the front, that white line down the middle, and it acts like a girdle or a lumbar low back brace. If you've seen people that have back injuries and they wear a girdle or a low back brace, that's your body's natural low back brace. All right, so let's pull this up. I am going to close that window because my computer is telling me that I am using too many resources. So hopefully you got me here in my two-shot. Perfect. So what we're going to go over is how do you activate this transverse abdominis. Let me pull this down and kick off my shoes here so we can get into this. With a lot of my clients that do have back pain, the research shows this as well, is that if you are having excess stress on your lower back, those muscles are too fired up. They're working too hard. And that's because the muscles above and below that segment are not working properly. So for example, this transverse abdominis we talked about, we're going to see, can you contract that muscle? Can you control it? People with chronic low back issues have no idea how to contract that transverse abdominis, that lower abdominal muscle, that deep abdominal muscle. So you're going to get down on the floor or on your bed, it doesn't matter. Both knees are going to be bent. And what I want you to take is your fingers here on either side and find your pelvic bone. It's super easy to find. It's the pointiest part of your hip bone here, the front part of your pelvis. And then you're going to pull, just kind of move your fingers in towards your belly button. Okay, so not towards your pubic bone, we're up in towards your belly button, just inside of that pelvic bone that you felt, that really sharp and pointy part of your bone. Now from here, I want you to pull your belly button into your spine, okay? So when we create that tension and feel like I'm activating that transverse abdominis because of all the different layers of muscle there, this is the one area that I can feel whether or not that muscle gets firm, all right? So when I say pull your belly button into your spine, you should feel that that piece of meat underneath your fingers gets taut and firm, and you can still breathe. Oftentimes people will start to kind of pull in their diaphragm and hold their breath to try and create this artificial tension and stability in their midsection, because that's the way that they've learned to stabilize. They hold their breath. But if you cannot breathe, you cannot function, you cannot stabilize well. You're just going from breath to breath hold to breath hold when you're trying to lift or carry or move something. So we want to be able to breathe because the diaphragm is up here, transverse abdominis that we're palpating is down here. We need to be able to differentiate those two muscles, dissociate those two muscles. So if you can kind of pull your belly button up nice and tight. The other cue that I've given my clients is that if you were going to try on a tight pair of jeans and you had to pull in the belly, that's the same muscle that does that. Or if you did like a little bit of a cough or bear down like you're going to go to take a bathroom break, or contract your pelvic floor, a Kegel movement, then that also should facilitate that transverse abdominis muscle contraction. So we're going to try and do that. And the big thing is that you should be able to do this. All right, this should be super easy to do. I'm contracting here. There's not a lot of motion because that muscle wraps around like a girdle. And when it contracts, all it does is create compression like this. It compresses the abdominal cavity and then creates tension around so that your lower back is more supported. Okay, so the next piece that we're going to get into is the hip flexor. The hip flexor is a muscle that starts on your lower back. It dives through the abdominal cavity and inserts into this front part of your thigh. Oftentimes, people will try and stretch this muscle incorrectly. They'll get into this position. So this is our classic hip flexor stretch. And then they'll just kind of go forward like this. And then what happens is that because I'm moving in this fashion, my lower back hyperextends and I start to search for this stretch. And because of this position, the origin and the insertion of that hip flexor muscle are not stable. So as I start to move, I start to pull one end and the other end starts to go. So it just kind of transfers in space. What we want to do is make sure that one end and the other end are stable so that we create separation. We don't pull the other end along. So to do that, we get into a position where there's no stretch. Just kind of hang out in this position. I'm not forward, I'm just back. And then I'm going to contract my abdominals, so that same transverse abdominis muscle, I'm going to contract that and try and contract this same butt cheek muscle, this glute muscle. So that stabilizes the origin and insertion of that muscle. And then you might feel that stretch right here in the front already. If we need more, we're going to translate everything, shoulders and pelvis forward until we get that stretch in the front here. And we're going to hold that for at least 30 seconds. 30 seconds is the bare minimum of time that we need to create a permanent change in that tissue and not have it get long and then snap back into a shortened position again. So 30 seconds with that stretch. The other thing I want you to look out for is the position of this back leg. If this back leg is out in this position, so if I'm going to give you my forward view here, we're going to try and keep that foot in line with my hip. I don't want that behind me like that. You could probably peek between my legs. My foot is not in line with my knee and my hip. I want to get it into that position. So that way we optimize our stretch and make it more effective rather than kind of feeding into movement dysfunction. All right, so another one is just kind of stretching out the glutes. The glutes are you know, they're important muscles to move and lift and carry stuff. So we can stretch that out as well because they might be overworked, especially if you spend a lot of time sitting. Because other than the hip flexor getting tight in the front because of sitting, the glute muscle tends to be weak, it tends to be short as well because of the body weight and the increased temperature that kind of just laminates that tissue. So what I did is I just took my ankle, crossed it over my other knee, and I gently kind of pull it off to the side. So I'm rotating that. I might get a little bit of a stretch here in my lower back, but I might feel it also on the outside of my hip. Again, 30 seconds for each direction, each leg. We're going to rotate the other way. So you could probably see different angles here from my two cameras. Rotating on one side, at least keep the ribs in contact with the floor. As you rotate, we don't want the ribs to kind of go. Keep your ribs down. And then as you let that hip slide to the side or roll to the side, we get that stretch into the hip and maybe into the lower back. And then we can also do like the classic hamstring stretch. You just kind of hold your leg behind your knee and then extend the knee or straighten out the ankle up to the ceiling. And then you should try to get a little bit of a stretch here. Bonus points if you do an active contract, relax here with the ankle, just kind of point and flex. As you try and straighten out your knee, push that heel up to the ceiling because that's going to pull and mobilize your sciatic nerve, which runs down the back part of your hamstring. So not only am I getting a hamstring stretch here, but I'm flossing that nerve to make sure that the nerve is also as mobile as possible so that it doesn't get scrunched or adhered or stuck in between the muscles of my hamstring. Okay, that's another thing. And let's see what's next. After that, we can go into a glute bridge, which is basically the same type of position that I was just in, and then working on trying to activate the glutes. So I'm going to get down on my back. My hips and knees are bent. My feet are flat, about shoulder width apart or hip width apart. And then what I'm going to do is I'm going to push my heels into the ground, lifting my hips up. As I lift my hips up, keeping weight through the heels, I'm going to imagine pushing my knees forward to the wall. And as I push my knees to the wall, maintaining this position, I need to be able to feel that my glutes back here are the prime muscle attaining this for me, right? So where do I feel the tension? I always ask my clients, where do you feel the tension if we hung out in this position? Do you feel it in the thigh or do you feel it in your back? Okay, so if you feel majority of the stretch on your back or your thighs, then that's a sign of a movement dysfunction. Your body has learned that you're going to use your thighs or your lower back to extend the hip, all right? Those muscles are inefficient in creating hip extension. This motion right here, it's just moving the hip, and that should all be glute. And what we're gonna do, if you're having issues with feeling the muscle out, I would just say, see if we can try and hold this for a minute and kind of cue the same things. Push through the heels, push your knees forward to the wall, elongate the spine and your thighs, and then that should get you into the glute. Another thing that typically happens with glute weakness is a hamstring cramp. A lot of times people will get up to this position like, oh, my hamstring cramps up. That muscle comes from the back of your knee and inserts into your sit bone right there. And it kind of crosses where the glute also works. And it is a weak hip extensor, which means that it helps with this movement of hip extension, but it doesn't have any mechanical advantage to create good contraction and good movement. So it goes into a cramp. If that's the problem, then we're just going to take it down to maybe just hold this position, put your hands right on your butt cheeks and see, can you squeeze or contract your glute muscles without moving? So if I can contract, again, I'm palpating that contraction with my hands here, and do my glutes, do my hips get taut and firm when I contract, all right? And if I can do that, can I do one and not the other? Can I just contract the left and then contract the right while keeping the other one relaxed? So that's just developing this motor pattern or awareness of how we are supposed to move using the glutes and not and the abdominals and not the lower back. All right, so once we get all of that done, I'm gonna put my shoes back on, we can get into another functional movement called a deadlift or a hip hinge, right? So we're gonna move this out of the way. And functionally, as we're moving around everyday life, we're always picking stuff up off the floor, bending down and picking stuff up. That functional movement could also be an exercise if we're thinking about how do I bend down properly to pick something up. You know, there's a lot of different ways that people do it. They'll say, all right, bend with your knees, right? And keep your back straight. So this position here, my heels are elevated off the ground. This is a very common position for a lot of people, common movement for a lot of people to do because they have limited ankle mobility. So the heels come up, there's a lot more pressure on their knees, and this is not ideal. So what we want to do is keep the feet flat and start to move from the hip. So as I stick my hips out, my butt goes back, my back stays straight. And we're taking what we learn from the ground position to an upright position, okay? So I'm saying I could contract my abdominal muscles, keep this brace, that transverse abdominis, and then use the hip and glute tension to have my trunk lean forward. So from this position here, I should feel like my glutes are activated again because we're just doing the same bridging motion that we were on our back, the same shape, all right? It's just hip comes up and hip goes back. Hip comes up, hip goes back. So you could probably see that this motion is similar to that glute bridge that we were doing earlier. It's just a different shape, the same shape, but a different position. And then once we can get that comfortable, then we can extend this motion a little bit longer, lower, so that we kind of bend and pick something up. My back stays straight, it doesn't round, and I'm using my glutes to drive out of that down position. So if I were to grab this medicine ball here, and I was going to pick that up, I'm going to do the same thing that we just talked about, keeping my back straight, hinging at the hip, using the weight on my heel, sending my butt back, and then picking the weight up from here. And then that is a functional exercise, and probably one that is the most bang for your buck and the most effective in creating a resilient back, being comfortable with moving this way using the hip and not the lower back, and using the legs to pick something up, all right? Once we get good with that, then we can move on to the more complex motion, is that we do the same thing except on one leg. So the progression would look like this. We have the hip hinge, okay? And then we could go into a single leg or a kickstand motion where I take one leg, I'm gonna use my right leg because that's away from the camera, and put the ball of my foot close to my heel of my other leg. So my left leg is where the majority of my weight is. I put the weight on my left heel, I send the hip back, I've got my core engaged, and I do the same hip hinge, all right? So it's the same motion, same shape, except now 80% of my weight is on my left leg. So once I get comfortable doing this motion with one weight or more weight on my hip, using that glute, then I can start to do it where I'm picking up this other leg, hinging at the hip, coming down, and then back up. So again, sort of like when I'm going to go pick something up off the ground and stand up. And I would do equal amount of reps, somewhere between 5 to 8 on either side, with a weight or without a weight, depending upon your balance ability. All right. So let's get back into this and see if anybody has any questions about what we did through that. All right, let's see. Okay, so this is a simple, quick little workout that you can do anywhere to kind of develop the stability of your lower back, the mobility of your hip, and then also increase the strength of your glutes. All righty? So let's see if there's any questions. All right, thank you. So yes, so one question that came up here is, how do you protect your knees with some of these exercises? Just like what we did before. If we're doing a movement that has any question with, all right, how do I protect my knees? I want to first be able to hinge at the hip more than bending the knee. So you can see as I go down, my hands are kind of like by my shins, but my knee has not moved forward, okay? A lot of times people will do this squat or this deadlift maneuver or this motion, bending at the knees like this. So the first thing that happens is that they bend the knees first. They bend the knees first, and that causes the knee to go forward. And inherently, it's not that bad, but repeatedly going through this motion may create more stress on your quad and then the stress on the front part of your knee. If we can unload the knee a little bit and make the hip move more, and that bends the knee less. right? So this is option one, where I'm doing a lot of knee bending, not great. This is option two, where I'm doing a lot of hip bending. That reduces the stress on your knee. Now, if we're also looking from the front, the thing with the front view is that we don't want the knees to go inside of the big toe, all right? So where your feet are pointing, if we're gonna separate like this and think, all right, I'm gonna keep my knees apart or keep my knees tracking, wherever your feet are pointing exactly, I want your knees to point maybe towards your third or fourth toe. So if we're gonna do the same motion that I just did, I'm gonna get my hips to go back and my knees do not go in, they're kind of pointing towards my third or fourth toe. If I point my toes out like that, doesn't matter. I gotta point those knees out that third or fourth toe. All right, so wherever you're pointing, if you want to do like maybe 10 to 15 degrees off center with a little bit of toe out, that's fine, but those knees got to be out going third or fourth toe, okay? The other thing with knee issues, Valentina, is the ankle. So if you remember that video and the diagram that I showed earlier, the knee is supposed to be a stable segment. The one joint below that is the ankle. That ankle needs to be mobile. People usually, when they come to see me, they have knee pain because their ankle is immobile. Their ankle is not as mobile or as flexible as it should be. So ankle stretches are going to be one of the key ways also to reduce knee issues when you're doing these exercises.